Our next story is another example of the differences between the U.S. and Great Britain. In America, healthcare is a private affair. In the UK, however, care is provided by the National Health Service, or NHS, a government system funded by the taxpayers. Entities called primary care trusts, or PCTs, are the part of the NHS that provides everyday medical care at the community level. But the rising tide of obesity in Britain is starting to sweep away the budgets of the PCTs. High demand for bariatric surgery, plus the cost of specialist equipment needed to treat obese patients, are swamping PCT budgets, and British health experts warn that current levels of spending on obesity care cannot be sustained. Some PCTs are responding by simply refusing to provide weight loss surgery. A recent survey found that 25% of PCTs have refused requests for bariatric surgery due to the financial burden on the NHS. The developments overseas may also foretell future burdens on the U.S. healthcare system. American voters recently decided that some sort of taxpayer-supported healthcare system is in order, and one of the biggest issues the new system will face is the obesity epidemic. Whether the U.S. healthcare service authorities will restrict the number of people who can have weight loss surgery remains to be seen. However, by watching how the British health system deals with the dramatic rise in obesity cases, we can hopefully gain insight into how best to respond to our own obesity crisis here in the States. Of course, one of the primary causes of obesity is the fast foods that are such a part of our culture. Everyone knows that fast food makes you fat, but what you may not have known is that eating junk food makes you happy, at least according to what U.S. and Chinese researchers have found. In 2001, the National Health Interview Survey in Taiwan examined the level of happiness of more than 2,300 children ages 2 to 12, then correlated this data with the amount of junk food the children ate. The kids ate French fries, pizza, and hamburgers washed down by plenty of soda and other sugary drinks and, unsurprisingly, got fat as a result. 25% of the kids in the survey sample were overweight or obese. What was a surprise was how little the extra weight mattered to them. Only 19% of the children surveyed reported feeling unhappy, sad, or depressed. The survey was the subject of a recent study led by doctors at National Taiwan University and the University of Arkansas. The results of their study, which were published in the Journal of Happiness Studies, found that children who ate fast food and drank soft drinks were more likely to be overweight, but they were also less likely to be miserable about it. Although the authors of the study offered no opinion on why a Happy Meal really can make kids happy, they did opine that programs aimed at tackling childhood obesity are more likely to work if they aim to replace the fun of eating tasty junk food with other kinds of fun. Well, that's all we have for you today. Thank you for joining us, and remember to send us your feedback by posting your comments in the box below the video player or by emailing us at news@weightlosssurgerychannel.com. And of course, we hope you'll join us again next week for more weight loss surgery news. Bye-bye.